severe shortness of breath, hemorrhaging, chest pain, syncope, etc. And then the questionnaire, typically, to be user-friendly, we keep it between 3 and 6 questions. Very easy to fill out on one screen. How long have you had a fever? What kind of, do you have a cough, shortness of breath? It's tailored to each individual symptom, just to be able to better triage and direct the patient. You then get to a summary page and then a virtual waiting area. And you'll see what it looks like on the doctor's side. But essentially, the patient will be in a virtual waiting area until the doctor calls them. That's a standard video call with an incorporated secure messaging service where you can exchange files, images, etc. And this, obviously, cachet is logged. Every single interaction in this app is logged. So in case we need to do quality control on it, we can pull out, with the right authorizations, we can pull out the logs of the case. So once you finish the call, you're going to get a summary statement. You were seen for this, your diagnosis is likely bad, and then you can actually send information to the patient. There's a section where you'll see where you can fill out patient instructions, and the patient will have it in their My Health tab, which is their portable health record, where they get the messages that were sent between doctors and patients, the consultations past and upcoming, and then in the consultations there'll be the summary statements that the provider sent, and then you have all the kind of standard health record components, past medical history, medications, vaccines, allergies, social history, etc. And you can also sync for people who have smart devices at home, right? Whether it's a glucometer, blood pressure cuff, they sync directly to HealthKit or Google Fit, and we can actually capture that data into the application and trend it over time. Then you have a list of the doctors by specialty, right? Behavioral health is psychiatry, primary health is going to be peds and family medicine. And for each doctor, you have the choice of offering a profile. So you'll have a profile page, we'll show you, you can fill out. Of course, only part of it is visible to the patient, if you wish it to be. Usually we'll put the languages that you speak, the years of experience, your training, background, etc. And then you can book a consultation with the specialist. So this is going to be the specialty workflow. On the doctor side, it's a web-based application. So all you need is a laptop, a tablet, or a desktop with a camera, of course. You log in through Chrome browser into this website, secure website. You put your email address and login and password, and you have access to this very simple dashboard where you have your calendar of appointments, and all these dots are appointments. You select a day, and then you'll have a list of, by the week or by the day, the different appointments that you have that day. And those are patients that either you as a provider have taken an appointment for. In the private sector, the application that we've developed for the private sector, patients select their appointment because they select their doctor, which is a little bit of a different workflow. And when you hover over a patient, you're going to have the summary of their time of appointment, usually their complaint. And this is, for example, my profile that you'll be able to edit, right? Your training background, education, your areas of interest or expertise, your years of experience. And then there's an area where you can actually view your messages. So this is kind of like the web app version of WhatsApp, for example, where you have your list, your threads, and then you can look at exactly the communications that you're undertaking with your providers, with your patients, sorry. And this is for the doctors who are authorized to perform urgent care consults, so the triaging function. This is essentially a virtual ER waiting area. You have the patients that register on kind of the first come, first serve kind of thing. So when they've come in, you select them, you open that file, and then it removes them from the waiting area. And on their profile, you're going to see the demographics. So this is what they registered with on the app, and also all the health information that they've input into the application. And if they've answered any questionnaire related to the specific complaint, you're going to have the answers in front of you. So all this is going to be available before you actually see the patient. This is a consultation. So I did one with Aziz. Very simple. You start the chat. It creates a phone call on the patient side on the application, and it rings on your end as well, like a regular phone ring. You have a standard video call, and then you have the note section. So you can actually, as you're doing the consultation, you can type up a SOAP note in that section. There's also another section, like I wrote a little SOAP note for his complaint. We'll say it was a headache. I prescribed some ibuprofen. No labs, no imaging studies required. And then you save that, and it stays in the record. So you can always come back to it later on. And then part of that record can actually be sent. There's actually another box that's not apparent here, but there's a box called patient instructions that can be shared directly with the patient. And if you are connected, and it can be as simple as being connected with an email address, lab, imaging, pharmacy, those boxes can be sent directly to that email address. So that's the simplest way of connecting to an ancillary service. And then the later stages will be full integration with whatever IS service is available. So you share the button, it sends to the patient their information, it says to the lab their orders, and everything else that remains in the record.
Okay. فهذا اللي يعني نبدا سريع جدا عن الابلكيشن on the doctor والبيشنت سايد. قبل لا اوريكم ديمو اول شيء بدي اخذ اسئله اي اسئله بالنسبه لي فاتي ما لحقت ارسلونها او any new questions منكم. طبعا فاحنا يعني مثل ما قال الدكتور نديم in the beginning if you want to do a new prescription يعني we can either link it to الصيدليه اللي عندكم either by an email address something very simple.
And our pharmacy.
نعم. او طبعا الايديال كيس هو الانتجريشن فيعني احنا يكون عندنا انتجريشن من الفارماسي اللي موجود الادويه الموجوده هني تكون موجوده بالسيستم الواحد يقدر يدورها ما يقدر يعني don't prescribe دواء ما يكون متوفر بالصيدليه مثلا. That's the ideal case. That's what we want to do is integrate those systems.
The app for the doctor on laptop only, not on
laptop, iPad, يعني شو اسمه desktop. الفون لا بس for one reason mainly لأن الانترفيس حق الدكتور راح يصير very tight يعني ما نكون مكان حق notes احنا ideal case is the doctor goes in writes the notes during the consult or after the consult. صعبة بالتلفون.
And this the app عيادة or the other one is صحافي.
عيادة هو عيادة مال
عيادة. And the password and username and password.
We'll create it for you. بس الإيميل مالكم information we'll create the profiles for you. You can change it.
And I can manage from home or
yes.
I just manage
anywhere.
Anywhere. It's web-based, so anywhere you want to be. No.
As an ophthalmologist, it's very hard for us to see all the reviews. We have to examine the patient.
Sure.
Especially the ones that
Right.
have to dilate, and have to do certain investigations.
Yeah.
Honestly, I don't think this will help me much in my clinic.
Right.
So it will be very hard.
Yeah.
I have to ask them to come actually to the clinic and examine them, and nearly maybe more than 9% of the patients. If
Right.
we are talking about the appointment, like subspecialty appointment, if it's like in a triage for the cardiology, maybe this will help.
Right.
Because there are some of the cases you can tell them this is urgent,
Exactly.
it's not urgent,
Exactly.
you can stay home for the triage system.
Exactly.
But for the subspecialty clinic,
Right.
it's very hard.
So of course, and that you raise an important point. You know, as an ER doctor, I'll tell you the same thing. I'm not going to see every emergency here, right? There's only for urgent care, minor emergencies, you can see a good majority of them. And those are the ones that we put up as a symptom. For specialty cases, sure. I mean, you know, if you're a retina expert, you're going to need to do fundoscopies, right? You're not going to do this online. But as you said, for triaging patients, right? Red eyes, painful, do you have blurred vision, do you have a headache with it? Come right now to the ER, right? Versus, it's itchy, it's, lacrimation, well, I'll order some drops and you can come and see me the next day. So for triaging, it's an important tool. For some areas of subspecialty, some surgical areas, you can use that as a follow-up tool, right? Even post-op patients, general surgeon, whatever specialty. Post-op, okay, how's your wound? Is it red? Is it leaking? Is it painful? No fever? Okay, good. I'll follow you up next week.
احنا يعني
You define, yeah, what is as specialists, you define what is reasonably, what you need an exam for consistently, and what you may use this for as a follow-up method or other reasons.
يعني احنا يعني كنا شغالين بالفواني والجهرة والولادة أو الدسمان بعد، ويعني primarily most of the patients are follow-up patients، فالدكاترة عارفين ال patients they know them they've seen them before.
Even for follow-up patients, you have to examine.
إيه مفهوم أنا قصدي يعني some of them maybe you see them once twice you give them بالقطرة أو شيء يقول أوكي check back in with me a week، ما يحتاج patient يتعنى يقول لك والله كل شيء تمام، يعني هذا هم it doesn't need an appointment ولا شخص يجي in person. But some things can be handled remotely، بس طبعا أكيد في وايد أشياء اللي يبي examination will not be handled by this.
Yeah, it's very clear that telemedicine does not replace the entirety of clinical medicine, right? It replaces a percentage depending on the specialty that you're in. But مثل ما تفضل Aziz, if someone needs a prescription refill, as simple as that, you know, why would they have to come over all the way to for that, right? Or sick leave, or even kind of a minor complaint. You can do some triaging, and then you can help redirect the patient, right? Stay at home, come in the ER. I'll see you next week. So for certainly you as a group of specialists will define that those clinical entities that can be seen online.
It seems that I missed one lecture before. I don't know. So when I interviewing the patient, so and he asked for some investigations. I don't know how it's going to be done. He has to go somewhere to do the investigation and come back.
Yeah.
And then prescription.
Yeah.
Whatever I'm prescribing to the patient, from where is going to get what is the way to get this.
So currently, what we've been doing with the other hospitals is we've been mostly they've been seeing follow-up patients. So patients, for example, we started off this whole project with endocrinology. So they're 100% lab-based, right? They need labs for everything.
Like our labs as well.
Okay. So they do a consult, and they say, okay, I need to follow up your TSH or your whatever measures. I've ordered lab.
Okay.
I've sent the order to the lab, and you just come in, do the test, and then I'll follow you up next week with the result, right?
How is this going to happen?
So, for example, بالفوانية with بدينا, it's actually all physical because they have to print out the lab request. So they do the consult with the patient. They say, okay, I'm on the computer system at المستشفى. I print out the request. I leave it with the nurse, and you just come in. So it depends on the hospital you're in. Some hospitals, the order goes in their system. Our system is not.
It's not connected to the lab.
لا احنا we're not yet integrated. Integration is a lengthy process that requires us to understand your system. So right now, when we come into a hospital, we provide a standalone solution. This works as a teleconsultation service. If you want us to integrate with whatever systems you have, we need to investigate the system and see how we can connect the two. So that's something that happens in parallel, and it's a process that requires the MOH approval, the central IT department to work with us.
اللي هو احنا هذا شغالين عليه already يعني كلمنا عنه
I
already.
know it's a very complicated issue.
لا بس يعني it's doable ترى يعني هي سالفة complicated it's doable. It's just a matter of well it's going to take a month or it's going to take 3 months. يعني هذه المسألة.
I expect that once I order the lab, for example, any for investigation, it will go to a concerned hospital. I have to choose it on the system.
بالضبط.
And then the patient will go there and find his name there. And
Exactly.
the list.
Exactly.
Correct.
It's going to be like this.
That's the plan. Yes.
Ultimately, yes. But that right now.
Now the reality is like this, or he has to show this to somebody to write the request, to fill up a request.
So مثل ما قلت لك الحين حاليا we're providing a solution that is not integrated with your systems.
Yeah.
Right? Integration is not something that you can do in one day. It's something that takes several weeks to months.
Okay.
Right? Because every hospital has a different system. So right now we provide the solution to be able to communicate with your patient, to write notes if you want to write notes, even send notes to the patient, so they give them some instructions. And then if you want a simple way of connecting this tool to lab, to pharmacy, to radiology, you can do it by email. That's the easiest way. So if they activate an email address, right, lab@bahar.com مثلا, they get requests with we already have kind of format of, you know, here's the lab request, you get the patient name, you have their civil ID number, the prescriber, the ordering physician, and that goes as an email. That's the easiest way to already create a link.
That was not available now.
Not currently, no. because we haven't the facilities we work with have not either they have no email address to work with, or they've decided no, we want full integration versus this early stage.
لكن تفعيلها هذه وايد سهل. يعني the actual email this can be done in less than a week if you want to do this. لكن اللي currently قاعد يصير المستشفيات are continuing with the current process من ناحيه البريسكريبشن واللابس. والله اوكي روح المختبر او روح الصيدليه حلل هناك. بعدين انا راح اسوي لك فولو بعد اسبوعين.
can show the investigation request in the mobile and ask and come to hospital ask to do this.
يعتمد على البوليسي في المستشفى. Currently they're not doing that. قاعد يطلعون لهم ريكوست او قاعد يدزونه بالسيستم. كل مستشفى مختلف. مثلا مستشفى جابر completely paperless. ما يس patient shows the civil ID ويا اسوي ريكوست. لكن مثلا جهره الفرعونيه لا لازم الورقه لازم هذا.
So what do you currently use? What's the method of
we do it manually.
handwritten? Yeah. So the option is now I don't know if it'll be accepted on if we send them the request the patient. That we have to see in terms of what the hospital approves. We can easily send them like an email or on
A file.
They can print
a file.
it out and they can go to any nearby lab. They don't have to come to the hospital to collect the request. This is number one.
Right.
Number two, if we are going, for example, to do other requests for X-ray or whatever,
Yeah.
we have to print it out. That is, we should have a facility of wireless printer, at least. If not a printer for each device like they have in the polyclinic.
Yeah.
So in the polyclinic when you go, the doctor writes down everything and then they print it out and give you the paper.
Yes, exactly. Yeah.
But here in the hospital with a lot of staff and this, I think if you're gonna use it in the hospital, it should be connected to a wireless printer.
Yeah, and all those solutions are relatively easy to set up. Whether you want to print here or you want the patient, a lot of times patients will not have printers. It may be more complicated. They may have it maybe just on the application as a PDF. But those are things that we will work with you with whatever solution will be approved by the institution. So we know that MOH has certain regulations. We want to make sure that we follow those regulations. But we're open to whatever you prefer.
May I ask for how long this system was applied in other hospitals?
Yep.
Like
الفرعونية قاعدة أكثر من شهر. الجهرة 3 أسابيع. الولادة تقريبا أسبوعين أسبوع ونص. فالحمد لله الأمور كانت يعني هم صراحة ضاقت خلقهم وايد لما قلنا لهم هذا الأسبوع ماكو على مال IT بس خلصوا الأبروفل. وايد تعودنا وكذا يقولون إحنا آسفين it's okay معلش يعني بس هالأسبوع إن شاء الله we can come back next week.
Approved or not yet?
لا هالأسبوع إن شاء الله they're working on it. إحنا طلبوا منا some technical documentation جهزنا لهم إياه. they just need to get it to IT.
وهي not started ophthalmology yet.
Ophthalmology
لا بدينا
عندنا 10 to 12 subspecialties يمكن.
Yeah, it's mostly so we started with medical specialties because the head of medicine there was the one who requested that we start with her department. So بدينا endocrinology, rheumatology, we did hematology, and then we also did a bunch of pediatric subspecialties, pediatric pulmonology,
pulmonary respirology.
Yeah.
When inshallah we will start our normal clinics after Eid. This system will be continue in parallel.
We hope so. We hope so. Now, for now, we're on a hiatus for 1 week. We're waiting for the Ministry of Health to approve the system. We've had a pilot that was successful that people enjoyed using, patients and the doctors. I was the past 2 weeks I've been in the maternity hospital kind of supervising it, and patients have been really glad. Doctors have been able to do like wound checks online. They've been doing all these things that don't need to, patients don't need to come in for. So, inshallah, I mean, we know that irrespective of our project, our process, telehealth is already established field in medicine. It's now across systems of the world. It's a component of the health system. We know that in primary care, up to 60-70% of primary care can be done online. Does not need the patient to be there physically. So, and that applies to pretty much most specialties at varying degrees. So we know that this is here to stay. Now it really largely depends on the Ministry of Health. Yeah.
It will say for the time being, patient coming to the hospital, minimize the number.
Yeah.
Is it meant for the current status, current era of COVID, or something?
No.
ground?
No, the COVID crisis only accelerated this
Initiated
process.
this process.
Yeah.
Okay.
But this is something that's been used for 20 years in
So it's
the
important
market.
to be integrated in everything.
اكيد اكيد yeah. That's the goal. احنا من الاول قلناها من day one. Just give us the green light and we'll start working on the integration. احنا so we're just waiting on that.
Yeah.
يعني احنا الداتا مالت الوزاره هم sensitive. احنا ما نقدر ندخل على الداتا and work on the connection الا لما الوزاره تقول لنا اوكي. فهذا ان شاء الله نرجع الاسبوع.
Okay, that's fine.
Any other questions or try the demo?
Anything regarding the blood investigations, if they have to, I don't know, it's not, maybe it's the ministry, from the ministry, to provide blood suckers at home or something like that. So this system, this system will not provide a team for laboratory investigation to be done at home or something like that?
That's a great question. احنا بالprivate sector, this is what we're doing. So this app was created for the private sector initially before the COVID crisis. We have a partnership with 2 private labs and 2 pharmacies, 2 pharmacy chains. So the idea is that everything happens at home.
Okay.
So if you need a prescription or if you need a test, you have home visits for blood draws, and you have home also delivery of medications. Yeah. So I know that الحكومة الحين تسوي حق some patients they do at least the prescriptions, right? They provide some medications to patients, but this is something that is relatively easy to set up. Yeah. Inshallah, they do that. Yeah.
Okay.
So this is the site the patient.
No, this is your site. The patient has an application. I'll show you. So on the patient side, so I'm going to be the patient. We have an application.
انا اول شيء قبل هذا بدي اوريكم بس السكيدولينج of creating of doctor profiles and the scheduling of appointments. But this is happening on the admin side, so you can assign someone بالمستشفى كadministrator to do this. لكن احنا الحين creating the appointments, we've made it حتى الدكتور can create their own appointments, can schedule their own appointments.
بس يعني على هذه احنا طبعا نقول educated يعني ورغم هذا عندنا صعوبه بان يفهم الشغلات يعني نحتاج طبعا وقت هذا شيء طبيعي.
اي نعم.
فكيف بالنسبه للمجتمع؟ مجتمعنا على مستويات متعدده
اي نعم.
منهم اللي لو داون واللي
صحيح.
ولا زين مع احترامي للجميع طبعا.
لا طبعا.
زين بس اعتقد لازم تكون هم من قبلكم او من الوزاره او من كذا حمله تثقيفيه شامله على اساس نقدر نوفق بيننا وبين كذلك المجتمع نفسه. ولا مستحيل يصير في كونكشن بينهم وبينهم مستحيل.
صحيح.
لا يمكن يعني.
احنا راح يطلع ان شاء الله تعميم من الوزاره واحنا اوريدي اكشلي عندنا سم ماركتنج ماتيريالز من ناحيه الاديوكيشن فيديوز كذا اوريدي جاهزين. فبس منتظرين التعميم. بالعكس الوزاره اللجنه قالت احنا وي ونت تو بوش على اول اوف ماركتنج شانلز. القوانيه يعني يعصرون يبون يحطون بالسوشيال ميديا الكونسلتيشنز مع الدكاتره. هم سجلوا كذا كونسلتيشن وذ ذا بيرميشن اوف ذا بيشنت. يبون يحطونها يبون يوعون الناس بس يعني ما يهمهم الا الوزاره يعني. بالعكس فور شور هذا. والامانه بيشنت بوبيليشن شفناه يعني شفنا من يعني اطفال بيدياتريكس اللي عمرهم 75 80 سنه حتى ولا يبغوا يوز ذا اب طبعا وصلها.
حتى الاطفال او النيو جنريشن هو اللي يعلمون الاباء.
بالضبط.
عندنا طبعا الحين الاباء والكذا والامهات اللي ما عارف يودي ولده حق المستشفى. شلون؟
هو على العموم اتس فيري سمبل يعني اطفال جونا حتى on the doctor side حتى on the patient side.
ان شاء الله.
registration يحاول
الله يكون عافية.
الله يعافيك.
Well, it's work because it's working now for taking a barcode for permission to go outside during the
ايوه يس الناس الناس غصبا عليهم.
But it will work.
Okay, so let me just show you على السريع. Sorry, resolution شوي هذا. بس basically احنا I can create an appointment here. I can also create a doctor. فالدكتور حط له first name, middle name, last name مثلا, civil ID, date of birth, بعض information, then I create the doctor. Easy as that. لا يعني هذا
create, because you need to create a profile for yourself, right?
يعني انتم تكون الغرفة تعطونا لستة. Okay, here's the basic information. We create the profile for you. Or you can have someone بالمستشفى كadministrator to access this وcreate the doctor. بحيث إنه in the long term دكتور مشى دكتور new doctor join ما يحتاجون تقول علينا please create. هذا it makes it very easy.
And this is the app I will download on my laptop.
هذا ويب سايت ما يحتاج داونلود حتى. just a website. فالappointment مثلا الحين أنا راح أسوي موعد جديد مع نديم. Let's say I'm going to follow up with him. It's a specialist consult. Alright, that's doctor. Then turn it in Kaho. my appointment date. Let's pick مثلا نقول له 4. Okay, it pulls the availability of the doctor الحين من الجدول. فانتوا تعطونا يعني اوكي والله انا من 10 ل 1 الكلينيك مالي، او مثلا 11 ل 2 او whatever، ولا بس بيسخر ساعه بالاسبوع. No problem. It pulls the whole availability from the system, and then you say, well, okay, I'll make it at 9:25 in the morning. Create the appointment. Done. Okay. And I log out. And I'm gonna log in as the doctor. This would again be your login, your username, your password here. فطبعا اول ما ادخل مثل ما وريناكم بالفيديو it's the exact same system. يدخلني على today. Again, as soon as you go in, you see your patients. It's very quick. ما فيها tabs و clicking هنا هناك. طبعا these are all my appointments for today. We did a bunch of test consults عشان كذا تشوفون اسامينا وايد. وفي sections اللي قلنا لكم اياها على اليسار. And I'm just gonna flip to قلنا Wednesday. اليوم كم؟ يوم 18. Okay. I believe this is it, yeah? Hey,
لا هذا انت as a patient.
Oh, sorry. It's the next day.
The next day.
Okay, Nadeem. Okay. So it's the test database for white field information. This is Nadeem's appointment that I just created. This is 25. I go in here. Oh, I have his information. بعدين رقم تلفونه, date of birth, civil ID. وهنا راح تشوفون حتى صورة البطاقة المدنية بحيث انه verification for the patient. You know, the new patient شخص ما تعرفونه بتأكدون. Yes, okay, this is in fact the patient. طبعا إذا هو حاط health information it will be راح يبين هنا عندكم. وهني الميديكال نوت patient instructions الشكل اللي تكلمنا عنها قبل شوي. And I'm going to start the call. It starts to ring. شوفوني أنا الحين كدكتور. قاعد يدق عند نديم.
So I get a regular phone call.
Sorry.
I didn't answer. Hold on.
فنديم رد علي. Start. Step outside. Okay. أحسن شوية. نديم شلونك اليوم؟
Yeah, I'm okay.
Okay. طيب ممتاز. فأنا الحين راح أكتب نوتس بلا بلا بلا. Patient instructions. Get some rest مثلا. اللي يصير. هذا راح ندز حق البيشنت. وهذه الأشياء كلها حق الدكاترة بس internal. Will not be sent to the patient. والله I'm going to prescribe Advil. اللي يصير. حلو جميل امور طيبه. الحين I can turn off my video here. The patient can also do the same. لما the patient مثلا تبي تنشاف وما يبي ينشاف بعد فتره يطفي الفيديو طبيعي هذا يصير. Can also turn off the audio. زين وبس سلامتك. الحين I'll save this. اوكي نديم مشكور يعطيك العافيه مع السلامه. End the consultation.
You said it in patient electronic file?
So for here as you're seeing هذه النوتس اللي أنا كنت كاتبها. This stuff, the medical notes, the prescriptions, the labs, هذه حق only the doctor sees it. The patient does not see any of this.
Which doctor?
الدكتور اللي قاعد يسوي consult.
Suppose you want to refer them to
يا سلام. Okay, excellent question. I'm coming to this.
Just a quick thing. So I get at the end of the call, I get a thank you, consultation completed, right? Thank you for your participation. Your provider is preparing instructions, and when needed, a prescription, referral, and follow-up appointment. We wish you a speedy recovery. The patient gets this, can access their record in the application, and then look at that consultation and see the notes that wrote for me. Get some rest, take those
أنا
medications.
can get some rest. فنزلت تحت. والله I want to share this with the patient. حلو. Share. Information share. فالحين نديم on his phone will get basically النوتس اللي أنا كاتبها. والله حلل تعال بعد أسبوع. والله get some rest. والله do something. خلاص. Patient has that. ما راح ينسى. ما راح يقول والله العذر إنه أحب الصفراء ولا أحب الخضراء. كل شيء موجود.
Share with the patient.
ها with the patient.
Share your notes.
Exactly. وبس
Yeah,
the
that
section.
section. So
Just-
the
just the
medical
section.
note stays, it's like in the medical record. It's the provider's notes. The patient instructions is what you give to the patient. Like when I discharge a patient
So
from
what's
EE.
shared only the patient instruction.
Yes, shared with the patient, yes.
Yeah,
Correct.
exactly.
Correct.
طبعا بعدين we can make prescriptions available as well so you can see the prescription history. هذا كله راح يكون موجود. Very good question about referrals. We're building the referrals right now. Inshallah should be done by the end of this week. فخلاص we'll be able to refer من دكتور لدكتور internally. فأنا الحين مثلا let's go to my patients. That's something أنا بوريكم إياه. Let's go to نديم مثلا. Again, it's a test database if you want information. اروح النديم سوري ريزولوشن شوي حوسه مع البروجيكتور، لكن تنزلون تحت هني هذه كل الكونسلتيشنز اللي مثلا انا كنت حاجزها are coming and here I can create a new one again الريزولوشن شوي حوسه بس I can say the reason كذا كذا و here I create a consult كدكتور for my patient as a follow up مثلا او مثلا بشوف new patient I can create them here as soon as they register with the database I can then create a consult for any time.
And this will be used for the referral as well, right? So you're going to be able to select the colleague that you want to refer to, or the specialty you want to refer to. You select a specialty, and then the provider list of doctors within that specialty.
This will be done later.
Correct. Well, actually, it's in the system now. So this will be available. We're just doing the final tests for that this week. But the referral system is something that's being finalized. Yes. Yeah.
وطبعا يعني this is a live يعني software مطلع ما قام. It's a live software that's being updated every week. احنا من اول اسبوع الفرعوني للحين صار في وايد developments وايد requests من الدكاتره can we add this can we add that can we do this. مثلا هذه اللونش سكرين اللي هي فيها جدول was requested إن لا انا ما ابي اسوي 3 clicks على ما اوصل حق البيشنت. ابي اشوف على طول patient development. اوكي فاين. One day سويناها we modified the dashboard. فيعني your feedback is going to be super important here. To developing this. وإحنا إن شاء الله مع الوزارة في خطة يعني long term من ناحية الديفلوبمنت شنو الأشياء اللي they want to add. We have our own plan طبعا what we think should be included بس we're learning every day شنو الأشياء الجديدة اللي you guys are requesting. أي أسئلة ثانية؟
We can upload a photo.
Yeah, that's a great question. Yeah. So we have we're doing final tests on this, but we have a secure messaging service within the application. So you'll be able to do a chat and submit images, and you have a repository داخل the patient's app, which is documents, where you can have all the images or results, whatever you need to upload. Yeah.
Going back to, we want to see the patient's name straight ahead. Can we make it so that when we go into, let's say, his lab results, it's already arranged by date, and there's like a thumbnail that shows me like a small picture of the result without going inside it. So I just, I know it's not this. I just don't even need to read it. I just go straight ahead to what I want to choose.
Yeah, so that's one thing that we've already, that's already in the plan for the patient application. So when you have, so actually in the chatting, so doctor or patient, in the chat system where you have, like for example in WhatsApp when you have like you get the thumbnail of the result or the PDF, we're going to have that available. If you want this to be, formatted differently, of course, everything's possible with technology. It's just about creating a workflow that we hope would be fairly consistent across institutions, so we don't have variations, among. There'll be slight variations depending on the specialties, of course, but the idea is to have something that's very kind of seamless and very usable.
فالحين مثلا currently today you would open the chat مثلا and you'd go and see the history مع البيشنت اللي في اللابس. لكن we can create like a tab اللي هو فيه اللابس مع البيشنت.
Can you review your video call?
Okay. Not
just in case I thought I saw him, I thought I saw something.
Yeah. فاحنا من ناحيه الداتا برايفسي وبيشنتس برايفسي we don't allow like الدكتور يروح يشوف الفيديو كول. لكن you can make a request to whoever would be like the super admin of the system and hey can you please pull up my video اتاكد من شغله. And then they would pull that for you. And how we use HIPAA standards in America of data privacy and security حق البيشنت and not for the doctor. Only people who access the patient record are the people in the care continuum. الدكاتره اللي هم كانوا يشوفون البيشنت مو اي دكتور يقدر يشوف.
لا نفس الدكتور خلص الكونسلتيشن and he wants just to review the video because he thought he saw something he wants to make sure.
صحيح. We don't currently allow that لكن إذا هذا يا request من الوزارة إنه we need to do this we can enable it ما في مشكلة.
Simply because of also the quantity of data that this requires, right, of space. So we log because we want to be HIPAA compliant. We log everything, right? But only in cases of quality control we can pull it out. So we're trying to, and also, I mean, obviously, even though it is your patient, there's certain privacy standards with regards to seeing physically someone, right? And so we for now and I think fairly standard across the board is only in cases of quality control. If there's an error or if there's suspicion of something that went wrong, you pull out the thing, and then either you or a quality assurance committee, like when you're doing an M&M, for example, you'll be able to review the case in its entirety.
Just to clarify, الHIPAA اللي هو ethical standards for use of medical data.
Yeah, it's data privacy, right, and protection laws, which is probably the most stringent law for data security and confidentiality, and it's a US act, healthcare act.
يعني هو مطبق بالكويت لكن يعني احنا قاعد نطبق لانه we think this makes sense من
Our
application.
profile would be available for the patient.
So yes, so your profile, there are some, if you want to go to the profile, yeah. So there are some sections of this that are available. طبعا مو email or phone number وكل هذا. But for example, you know, you can decide what you want to put in there.
But it's not obligated about my mobile.
الموبايل حقنا حق administration. We need to be able to contact you. بس مو حق البيشنت هذا لا. These are fields that are hidden from the patient. Phone number, all the personal data is secure and it's confidential. Some of the other fields like مثلا, and you can define that. Experience, medical school, you know, your areas of interest, your area of expertise as an ophthalmologist, what's your area? So the patient at least knows a little bit more about you. I think this is the novelty that we want to try and inform and empower the patient شوية a little more.
بالأول لما كنا قاعد نفكر بالقطاع الخاص قلنا أوكي المريض بدش مثلا عنده 5 دكاترة قلب يبي يشوفهم. شلون أعرف والله أي واحد بشوف والله كم داس مشيت والله أوكي هذا البروفيل ما عجبني والله هذا تخصصه في one of the diseases that I have. And the patient can go choose the doctor they like and book the consult. الحكومة it's going to be a bit different. العادة المريض ما يدش يقول والله أنا أبي الدكتور هذا يقول أوكي عندك موعد وعندك مع الدكتور الفلاني. ف it's less applicable من ناحية إن the patient choosing the doctor. لكن for you can put as much or as little info as you want. ما تبي تحط عادي ما في شيء.
My question is, whatever I wrote in my profile will be available for the patient?
No.
Or there is some items will be written, this is available for the patient and this is
Exactly.
will be hidden.
Yeah. We'll let you know, but just know that at least all the personal identification information is not available. So they're going to have your name. They may have, you know, like I said, your times of consultation, your medical school, if you wish to put it. كل شيء civil ID, phone number, date of birth, phone number, all that.
The fees also?
Sure.
The fees?
So the fees, yeah, this is because this is done for the private sector. So طبعا في الدكاترة initial consult is one price, follow-up consult is another price. Initial consult is 30 minutes, follow-up consult is 15 minutes. So this we have to tell the patient, you know, depending on what they decide. Sorry? Well, there's prices, of course, for non-Kuwaitis, yes. So
Encourage people.
Yeah, absolutely.
Does the system record the consultation records?
Everything's recorded.
Okay.
From the beginning, from when you log into the app, every interaction, whoever accesses the profile, the video console, the voice, كل شيء is recorded.
This may need be in the medical legal things.
Sorry?
طبعا.
Because the medical legal things.
Of course. That's what we're saying, that for quality assurance purposes, you have to be able to identify who accessed the app, when, so everything is timestamped. You know, the name of the person who logged in and looked at the file.
And the voice.
كل شيء, yeah.
Okay.
Concerning tracing back the profile of the patient, he may be seen by different physicians.
Yeah. Yes.
And you access that.
Yes.
Yeah, that's a
And
great.
see the diagnosis because sometimes,
Yes.
you know, there is a lot of things would happen.
Yeah. So the advantage of being in a system that is massive like the Ministry of Health is you're going to have visibility على كل. You're going to see actually for each patient profile you're going to see their past consultations. So you're going to see okay شاف الأسبوع اللي فات راح فروانية endocrinology. Correct. What happened? If any medications changed or added? So you're going to have that whole continuum of
including the name of the physician.
Of course, yeah, of course.
This is an example. أنا patient did a bunch of consults. One with Dr. Nadim, one with Dr. Amir, one with this doctor. I can then go into each consult. وراح يكون فيها details, notes, prescriptions, كل شيء اللي صار.
Nothing is static.
Yeah, exactly. And that I think is the huge value of this is that here we're talking about the virtual space. We're not talking about the physical space. But even then, you have this visibility which you don't have currently, even within your institution, right?
Like actually, the goal is once you integrate to the HIS and stuff, is that you also have access to all the consults that happen with the patient. فراح يطلع لك بلون ثاني أصفر مثلا، هذا كانوا physical appointments بس، لكن هذا اللي صار. بحيث إن حتى لو يعني شغلة صارت قاعد تقول I know a doctor saw them before me بس ما شافها بالسيستم هذا، شلون راح أعرف؟ لا بالعكس، that's the goal is to have the systems integrated so that the physical and the virtual are bridged.
حتى البرايفت أقدر أشوف المريض وين راح.
والله يا ريت.
That's my dream. My dream is to have a universal record for the patient. But the institutions are not willing to do that. وزارة الصحة, they want it in their own servers. Dasman wants it in their own servers, so they want to create separate tools. So we don't have, for now, interoperability.
لكن نتمنى actually with that.
عشان تعرف المريض.
ايه وايد احنا قعدنا بكونسلت وايد الدكتور يقول انزين انت رحت حللت باي حللت شهر 6 زين وين التحليل؟ حللت بالخاص. اوكي زين زين قلت لي that's why I don't see the system عندي. بالعكس we would love that يعني the bridge now is the chatting system فوالله انت حللت بالخاص زين صور لي هذا الحين بالكونسلت عشان اشوفه. Great, so I can do that immediately اليوم.
But you don't have the option where he can upload it and you can see it.
Exactly. أو حتى يعني the very simple one during the consult زين قرب هذا على الكاميرا. We've done this a few times. شوف patients انزل تعب التحليل اوكي تمام امورك طيب.
Ultrasound reports, radiology reports,
even for the medication.
Of course, yeah.
Because if you can collect it from one center, it's traced.
Exactly. Yeah, that's important. That's
For example, as you said, you tell him, show me your lab result and go down to see this.
Yep.
If you show me your body, is there a way that you capture as a document?
Yeah, you can.
So currently, I mean, unless you take a picture,
Screenshot.
but you can tell them to upload it into the chat.
This is one way.
Yeah.
Or
They can take a picture of it themselves, and it goes into the chat system. And it's,
otherwise you can't
ما تقدر
send any picture.
صح.
while they're consulting with you, but you can tell them, okay, take a snapshot and upload it into the chat. Bas, it'll be.
Another thing, for example, he's showing me something in his leg, for example, swelling or something.
Yeah.
How can I do it? Can I tell him also to take photo and upload, or I can capture it during the video call?
That's a good question. The problem with capturing during the video call, well, maybe you could do a capture of the screen.
On the system.
We can add the screenshot.
Mobile now, when we're having a video call.
هل فيها
Yes,
مشكلة
if you're
إن
taking a
أنت
picture,
review
but through
something?
the
I just can't capture it.
Yeah,
What you're doing the video call.
هو على العموم a lot of the video call applications do have the function where you can take screenshots.
Screen. Yeah, we can include that.
يعني
Yeah.
هذا الافكار اللي يعني we didn't think about يمكن قاعد تطلع
حتى
يعني.
قاعد افكر شنو لما اقول لك I want to review a patient, let's say a patient has على سبيل المثال dermatology يعني عنده مثلا rash. I want to say this rash is improving. I will not remember every single patient I am seeing. But when I have a record of pictures I can compare.
Yeah.
Then yes, it becomes easier.
احنا يعني this is a good example مثلا شفت البيشنت هالاسبوع اوكي great you have a rash زين حط كريم ودزلي بعد اسبوع صار. بعد اسبوع بدون اصلا بدون ابوينتمنت بدون ما ياخذ موعد ياخذ مكان بالسيستم وياخذ مكان بيشنت ثاني كان ممكن ياخذ موعد معك يصور الراش تجيك مسج دش الحين تشوف there's going to be a messaging tab او a new notification او بيشنت الفلاني اوكي كان صورت الراش يا امورك طيبه good job ولا actually it's getting worse راح اسوي لك موعد تعال come in person. So the follow up becomes حتى it gets taken offline والواتساب مالكم ما يصير في انفجار من عند البيشنتس كلها تصير بالسيستم هني فحتى الاوفلاين اورز والدكاتره getting messages late at night this all happens in the system. You can define your working hours انت تبون تشتغل من البيت على راحتكم ما فيها شيء تدشون تشوفون كل شيء من البيت والله ما بيشتغل من البيت خلاص انا المستشفى اطلع you can also do that. تفضل.
So I'm trying to understand, so this app is a way to communicate or is it an EMR integrated or you need an EMR to integrate? Because when you have a patient you need like a file or something like that. So I don't see like an EMR. So is this basically a way to communicate with the patient only?
So this is primarily, yes, a communication tool, right, that allows you to follow a certain clinical workflow, right? So you have the urgent care appointment-based. And of course, you have a basic EMR, which is what we showed you in the application, right? The patient can fill in. Of course, for it to be useful and not to add a workload on you, it would need integration with the EMR, with any existing EHR or HIS. So those are some things that we absolutely need to work on because we know as clinicians, I know that I don't want to, I've used every single HIS system pretty much in the US. I know that for the most part it adds to your workload. It doesn't make things easier. So for this to be useful, it has to be integrated ultimately. Right now it's useful because it gives you already a contact when you need it now, right? You can contact patients right now.
Yeah.
You can already,
But speaking to the EMR, I'll give you an example. So I used to work at Apple, so I spent 3 years at Apple in the US. وهناك they had their own medical center, our own system. So I would go in, I'd log in like this, and I see my blood pressure over time. Every time I went and got checked, the stuff got uploaded. I could see my weight over time. I could see everything that happened. It was incredible. So for me, this was my medical record. I could go see it anytime I wanted. But that's actually our goal with the patient, is eventually the patient will be able to go in and like see, okay, well, I tracked حللت اليوم كذي صار, okay, but after time it went down, it went up. My blood pressure, I'm up for diabetes, I put in my recordings, my glucose recordings, actually pulling those recordings automatically from your health kit. So one thing we're working on with Desman right now over the next 2 weeks is being able to integrate with the Apple Health Kit and Google Fit, so that at least, at the very, very least, your steps, your heart rate, that stuff is being able to be seen by the doctor. And then that's also part of your EMR. And then once they have their smart devices, because they have a lot of smart devices there, those devices are already pushing to the phone. And they're pushing and they're integrating with the Health Kit and Google Fit. So we're going to be able to pull also the glucose readings, all the different diabetes measurements for the doctor automatically. So you don't have to ask the patient to record them, because as you know, patients will typically not do that. The goal is, yes, to have a portable EMR for the patient and for the doctor also to be able to be seen at any time.
I have a question regarding your servers.
Yeah.
Are they on the cloud?
Yes.
Because then there's an issue of, it might get hacked or breach of privacy.
Yeah.
If it can be, let's say, a physical server, which it's more safer.
Right.
Yeah.
So that's a discussion that's actually the reason we have this kind of hiatus right now, right? To talk about the hosting and where this data is. So rest assured, cloud is pretty much as secure as a server today, right? Because you have Microsoft Azure, you have these that are, by the way, HIPAA compliant. So for a cloud to be HIPAA compliant, that means it has to follow the most stringent data security measures.
But they are HIPAA compliant.
Yes.
Sorry?
Yeah.
Yeah, of course.
For the cloud, you have disaster recovery. Server صافي شيء كذا. You already have a backup server in another country, for example, that has that data. But the physical server, you can, إذا صار في لا سمح الله زلزال صار شيء خلاص, the data is gone. لكن احنا we prepare the data sheet حق الوزارة فيها comparison very objective. Here's what cloud does. Here's what server does. Pick whatever you want. We'll implement. ما عندنا أي مشكلة. This can be implemented on a server or on a cloud.
We're not a cloud-based
So basically, the options were given, but the choice.
Of course,
exactly.
And we're just waiting on the choice.
Yes.
يعني whatever the ministry chooses, إحنا راح نطبقه, ما عندنا مشكلة. From day one, we told them this. That they want servers, we can do servers. Desman, for example, is they have like their own everything كل شيء داخل السيستم عندهم, but they want it on their servers. فخلال أسبوعين it will be on their servers. Done.
So if it necessary to be done by a doctor, this job be done by medical secretary, for example?
من ناحية الأكتو appointments ولا؟
هي الappointment
لا, to be done by anyone. It's scheduling. Yeah. Today we do it through an admin dashboard basically. I'm making the test appointments to the yes.
The same dashboard where you made an account for a doctor.
بالضبط إيه. فهذا it's a super simple dashboard. Anyone can you can assign, typically you assign one super user or admin. مثلا الحين تبي الدكاترة تقول حق النيرسز أو حق الشخص الثاني هذه مواعيدي, please schedule my appointments for next week. What we're doing today الحين is كل دكتور أو كل مستشفى قاعد ينزلون لنا مواعيدهم أول الأسبوع. أوكي هذه البيشنتس هذه رقم تلفوناتهم, contact them. فإحنا we contact them, يا جماعة الخير في app كذا نزلوه, if you have any issues let us know. Once they register, they confirm. إحنا we go in and we make the appointment for the doctor, and then the doctor shows up to the appointment. كل المواعيد موجودة. All they do is give us a list of patients. والله بيشوف هذول 10 سنين والله. خلاص. بس لكن the preference is for the hospital to handle this whole continuum. بحيث إن إحنا ما يصير نتدخل إلا والله tech support, some issue, والله we want to modify شيء بالsystem in the future. بعدين ندش عليهم. Otherwise, the goal is for you not to need us eventually. لكن احنا حاضرين. We've been at the hospital every single day for the last month. مع الدكاترة we're doing the onboarding. We will not stop until you tell us, okay, خلاص احنا we're good.
We have by the way, a starter kit. We have a file that we give to the hospitals with the instructions, both for instructing patients and for training doctors, and their videos to have it. So there is a process for onboarding providers.
Can we try with system today, for example, at home, or when can we try it?
Yeah, we can. What was the plan? I think.
But we don't have to create our own username.
So we would create, like we did now. We create the doctor's profile, and then you can, if you want to be like the patient, you can download the app on your phone, and then you can test it between yourselves.
So we can try it today, for example.
You should be.
Yeah, احنا بس أعطونا بس information معكم عند الدكتور. تفضل في his email his information. So we're going to create their profiles. أعطونا profiles من whoever wants to try it. we'll make you a doctor account so that you can use your account. زين وبعدين نزلوا الاب على تلفوناتكم او تلفونات اي عند بيتكم شو اسمه to try it out and you can test it at home. وإذا عندك مشاكل نعطيكم والله من customer service تكلموها على طول ترى قاعد يصير شيء قاعد يصير كذي. That's actually good feedback for us. إذا في errors في مشاكل.
So on the long run الكاستمر سيرفيس راح يكون 24/7.
هي طبعا الحين she is 24/7 effectively. Yeah, she's يعني all day and all night شغالة مع patients لكن yes.
طبعا أنا أقصد two customer service واحد يكون للhealth care workers وواحد يكون للpatients.
Absolutely yes. لا we will scale this up as we need to. We already hired a bunch of part-time people to help with the onboarding.
Maintenance طبعا لازم يكون regular maintenance بالنسبة
Of course. That's going to be part of the plan is to have regular. As you've seen من أول ما بدينا للحين we pushed 40 versions of the app to the patients. Small updates, bug fixes أشياء هذه 40 version من April 19th للحين. It's constantly being updated. And as we speak, the developers are in the meeting to add the feature that we requested yesterday.
I know it's individual choice who's going to for the doctors, or it should be an obligation for all doctors in the hospital.
قصدك for the video consult نفسه؟
register in the system.
أي whoever the hospital wants. For example إحنا عندنا مثلا بالسكر المثقفين educators, diabetes educators. هذول يعني they're nurses لكن their role is very important. يعملون patient choice ولا readings بالpump يتأكدون منهم. بالفروانية for example we have an educator that has 2 clinics a week or 3 clinics a week actually with patients. She sees 5 to 10 patients each clinic. بس تثقيف through this little video. She loves it. يعني شو اسمه وايد مستانسة.
all the people will be included in the system in the hospital, or it's left by choice whoever wants to.
Whoever you want.
So the institution decides. We provide the software. You as an institution decide.
Yes.
Okay, this clinic or this specialty will use it, or everyone will use it.
Yeah. أعطيك مثال يعني قسم النيورولوجي بالفروانية كانوا مترددين أول قالوا لا وهذا ما راح ينفعنا وكذا. أسبوع ونص ما أعطونا دكاترة. About 2 weeks in, they started giving us doctors. الحين عندهم 3 doctors on the system. And they saw the value. It's up to you if you want to use it. حياكم الله. If you want to use it, هم ما عندنا مشكلة.
So if we come back from that, is it like طبيبي?
إيه شلون يعني؟
There is an app in the.
إيه.
It's طبيبي.
Yes.
That would be the same, but more in relation to the MOH.
Yes, yeah, it's a similar concept. It's like yes, to be tailored حق الوزارة. Exactly.
I have a question. If we want to integrate it with the system,
yes,
then for taking appointments, it has to be that everybody has an account.
Yeah.
Otherwise, you cannot give an appointment with, let's say, Dr.
فهمتك. Yes,
Dr. if he's not on the system.
يا سلام عليك. فإحنا actually the ideal case, and we have this in the starter kit بالguide موجود, is if you send us an Excel with everyone who's currently employed, نحط لهم profiles خلاص. اللي ما يستخدم عاد ما فيها شيء. يعني ما ضر إنه والله زدنا اسم دكتور. بس actually
ما تقدر تلزمه بس الفكرة يكون عنده account حتى لو الناس تعطي المواعيد.
بالضبط. Totally fine. أسئلة ثانية. طيب احنا على العموم احنا حاضرين والدكتور عبد الله يدري you can contact me at any time. الله يعافيكم وإن شاء الله we'll be in touch مثلا مع الوزارة و try to implement this as soon as possible.